Real Country 1430 AM and 107.3 FM WRDN. I'm Brian Winnekins, and joining us is Pepin County Health Officer Heidi Stewart. And today we are going to get an update on the COVID-19 situation and here in Pepin County. And Heidi, thank you for joining us. Well, I guess it's been a while since we've talked because of the holidays and stuff, but give us an update on where we're at here in the county. I know one thing, at least for testing and all of that, we are going to be having another testing day on Thursday, the 7th, and really every Thursday this month, right?
Right. So testing was one of the topics I wanted to talk about. We continue to have some really good resources around testing, one being our local facility here, Advent Health. They continue to test on a routine basis. Their testing turnaround is actually same day, fairly quickly. So that is an excellent resource for the individuals within our community. Another good resource for everyone is that now going to be weekly, a Wisconsin National Guard testing site at the Durand Highway Shop from 10 to 6. You do have to pre-register. Well, if you can, you should pre-register. I think you can register on site as well. It goes really quick. So far there hasn't been long lines. The wait time is very minimal, and the result turnaround is approximately 2 days. So if you're really looking for a quick result, the Advent Health is the place to go. If your turnaround time doesn't matter, the wing testing is another wonderful option. If you'd like to do testing within the confines of your own home, you could order a test kit from the Department of Health Services website. And I did put some information on our Facebook page about how to get that. There are a couple downfalls with that at-home testing. You have to have good internet access because you have to do a telehealth visit with somebody and you're actually monitored taking the swab. And then you do have to deliver that to a USPS. No, not USPS. UPS drop spot. So I'm not aware that we have a lot of availability of those within Pepin County. So it's kind of a downside, plus the wait time for the results. I would suggest using option 1 or 2 that I mentioned earlier. As far as case numbers go, overall, we have seen throughout December a downward trend. We did have a few spikes. There was a spike right around the new year where we had a couple days where there were high numbers. But for the most part, since the beginning of 2021, our case numbers have been averaging less than 5 cases per day. So I would like to really see us stay in that area. We have to continue to encourage people to be doing the social distancing, to be wearing masks, to be washing hands, and staying home if you're ill as much as possible. Our case numbers that were reported on the DHS website were 691. The state of Wisconsin is over 500,000. So if you watch that those case numbers continue to flow in quite steadily throughout the state of Wisconsin. For a total number of hospitalized, we've had 26 individuals hospitalized throughout the course of the pandemic. We only currently have 2 individuals hospitalized. We have had 6 deaths within Pepin County that have been related to COVID. The most recent one was yesterday, and our condolences go out to the friends and family of that individual. The case fatality rate for the state of Wisconsin is 1%. Our case fatality rate is 0.7%. Excuse me, got a tickle. For the most part, hospitalizations throughout the region are in a good status right now with bed availability. And like I mentioned before, we would certainly like to keep it that way.
And Heidi, I know that there's been, since all of this, there's all kinds, there's been a lot of controversy about the masks and the social distancing and things like that. But the real reason is, and I guess the reason I bring this up is I'm kind of living this with my mom right now, where we need to get some potential physical therapy and more, and down in Southeast Wisconsin, where it's a lot severer, if that's a word, that's not available because of the hospitals are full and the medical staff is all of that to deal with. And that's the reason we're wanting to do this, so that Advent Health here only has 2 people at the hospital and still can function normally instead of having 50 people in the hospital, and now they can't do normal things, correct?
Yeah, so from the beginning, we've asked the community, we've asked everybody in Wisconsin, across the nation, to look at the big picture. This is more than just you and I here. So, the actions we take and the preventive measures we follow can have widespread consequences. So together, we're going to move through this faster if we can follow those things. And I know your situation that you're dealing with is very frustrating. And there's many people that I'm sure are dealing with frustrating things. So we don't have one button that we can push that will erase all of this and make it all better. But we do have a new tool in our toolkit. And if you saw the Courier Wedge last week, you saw that the vaccine has arrived. And we are starting to work through, well, actually, we were almost at the end of what we believe the end of phase 1A here in Pepin County. So I do want to spend a little bit of time today talking about the vaccine. So the vaccine is coming from the federal government to the state of Wisconsin. The state of Wisconsin is dividing that up and shipping it out to what they call hubs. There's 8 across the state. Those hubs break that vaccine down and then they send it. Each week, vaccinating providers. So right now, Advent Health is the key vaccinating provider in our community for phase 1A. The health department is also signed up as a vaccinating provider. But instead of both of us doing that, we are teaming together to do it, where we are helping with some of the logistics, the scheduling, the planning, and they are actually doing the vaccine into the arms of the individuals. So much appreciation goes out to Advent Health for all of that. The state of Wisconsin doses are divided up, and on average right now, Pepin County is getting about 100 doses per week. We are getting the Moderna vaccine. So if you're not familiar with the differences between the Pfizer and the Moderna, there is a lot of information out there on it. We haven't had any significant side effects in Pepin County delivered doses thus far. The hospital does have it set up when you arrive. You would do a brief registration, make sure all the forms are filled out. You would get your vaccine, and then you are there at their facility for the wait time to be observed, and then you are released. So if any severe anaphylactic reactions happen, you're right there where the immediate care can be provided. And that's one of the key reasons for having Advent Health be the primary provider right now. The other reason is the individuals in phase 1A are, the people that work at the hospital, the primary care people, the physicians, the nurses, the OT, the PT, the respiratory therapy, the radiologists, the lab people. Those are all the 1A. They were able to move through their facility and vaccinate those who wanted to be vaccinated fairly quickly. So then after that, we opened it up to another key group in phase 1A, which is the EMTs and the emergency medical responders, those that, are responding to calls on a routine basis. So moving through those priority groups, we now have went back and are throwing that one last net out to see if we've missed any unaffiliated providers. So we're looking for dentists, chiropractors, pharmacists, home care workers, all of those other individuals that fit into the 1A category. We're scheduling actually for the end of this week and then early into next week. It's gone so well here in Pepin County with that first 1A process. Advent Health is actually vaccinating for some of Buffalo County providers that fit into that category as well. The biggest question that we're dealing with right now at the health department level is, when does 1A stop and when do we move to 1B, and how will that happen? So we did receive an email today from the head of the COVID response at the Department of Health Services, and the current decision that was made it sounds like it was made earlier this morning, is that the state of Wisconsin will move through the phases together. So if Pepin County gets done with phase 1A, we cannot move on to phase 1B until every single county in the state of Wisconsin confirms that they believe they have vaccinated everybody in phase 1A that wants to be vaccinated. So we could be in a situation where we get our phase 1A done and we have to sit and wait a week or 2 weeks until the rest of the state catches up. And that's a little bit frustrating. We want to get this into the arms of people. So the state is working on figuring out the way to get that vaccination capacity up to where the vaccine supply is, so that it's not sitting around on a shelf in a refrigerator, I should say, or in a freezer. It's getting where it needs to get, and we can move through it as quickly as possible. Who is in phase 1B? I don't 100% know. There is a draft copy available. Well, I don't know if it's even available because I haven't been able to find it again, but there was a draft copy that was shared from the State Disaster Medical Advisory Committee on where they thought the phase 1B people would be and who that would be. It's looking that that phase is going to include people ages 75 and up as a key priority. It looks like it's going to include educators as a key priority. Other first responders such as law enforcement and fire. And then as you continue to go deeper into that list that they're looking at, it's possible that phase 1B could include everybody ages 50 and older. So phase 1A and phase 1B could take out a significant chunk of the individuals in Pepin County, as far as those that want to be vaccinated and qualify under those phases. So pretty excited about that and starting to ramp up to be able to move through those lists as quickly as possible when we can.
So Heidi,
really a lot, and it was really long-winded, but it's the questions that we're getting on a routine basis.
so
Another question that we're getting is, if I've had COVID, can I get the vaccine? Yes, absolutely, positively. If you've had COVID, you can still get the vaccine. You just shouldn't be within that 10-day isolation window, and you shouldn't be having some type of symptoms.
So Heidi, if let's say in the phase 1B, let's just say yours truly would be able to be a part of that, or just a member of the general population, someone who's 75 or older or 50 and older, if that's how they determine it. How do they have to call you? How do they get into the line if it's time for them to get in line? What do they have to do?
Yeah, so right now, and actually we organized this a bit this week, we started taking all the phone calls to get people signed up. So if you believe you fit in phase 1A, you should be calling us right now. If you look at that listing and, oh, I don't really think I qualify, but I'm pretty sure I'm going to qualify for 1B, I would really encourage you to wait until you see an announcement saying that we are accepting phase 1B individuals. We don't have like a backlog list where we're keeping track of stuff like that. If that changes, I will let you know, Brian, and you can put something on your Facebook page, or you can start to broadcast routinely on the air. If you are part of phase 1A now, if you're part of phase 1B, please call the health department to schedule an appointment. We're also looking at some software scheduling options. I know I have a webcast tomorrow, so looking at the most convenient and the most seamless way to go ahead and get these appointments scheduled.
So Heidi, I know that I asked Angela this yesterday, but I'm assuming that members of the health department were in phase 1A because of your job. So did it hurt when you got the vaccine?
Yeah, so I actually have not received the vaccine yet. We did have I was off last week. So I was not in Durand when they were administering it. So I did not. A couple of the staff from our health department here did receive it, and they did experience some soreness in their arms. And it was a couple days. I mean, they were saying that, yeah, there was some soreness and stiffness in the arms, but they didn't report any other symptoms or complications. I do qualify for the vaccine personally as an EMT and as a public health nurse. But I do think it's really I think it's important for me to be responsible with that dose of vaccine and make sure it gets to the people that are actually having face-to-face contact. I haven't been actively doing EMT work during this, so I don't really think that it's fair that I use that trump card to bump ahead of somebody else. And I have notified them that if they get to the end of a vial, and this is maybe something else I want to talk about with the group a little bit, if they get to the end of a vial, they have not got 9 people and that one dose is going to go to waste. That's when I'll come. Let me help you use that last vial, last dose up. What I think is important for people to understand is you could hear of maybe somebody not necessarily in 1A getting a vaccine. If we run into a situation where we have 8 phase 1A people that are ready to go ahead and get that vaccine, and that means we're going to have 2 doses left, we are going to look at that list and see who makes the most sense for us to bump up to get that next dose. Is that our law enforcement? Is that some of our fire? Is it an elderly individual? You know, we'll look at that and use it. So we are really, really, really trying to follow those phases as much as possible. It's important for the community in general to know that if the health department or the hospital or the pharmacy, when they start vaccinating, if we do not do it appropriately to the appropriate people, we risk losing our ability to do vaccine. So it's really important that we stick to that.
Talking with Heidi Stewart this afternoon. Finally, Heidi, I know there's a new app that has been released. It's the Wisconsin Exposure app. Tell us about that.
Yeah, so I have tried that out myself. The Department of Health Services has an app. If you go to their website, you can download the app, and it works off of Bluetooth technology. So for example, if you test positive, or let's say I become ill, I test positive, I would go onto the app on my phone and indicate that I had a positive result, and that happens. You know, there's some safeguards in there that people can't just be falsely entering that information. This is a very broad explanation of what this app does. It will go back then and send a text message to the individuals who would have been potentially within the 6 feet for more than 15 minutes. So the way I'm not going to claim to understand how the whole thing works, but if you're interested in it, go ahead, look at it on the website, download it. It's a way to make sure that if you're exposed, if you're around somebody that you don't know, that somebody maybe wouldn't be able to recognize you and call you and say, hey, you were close contact to me during my infectious period. This is something that you can use. There's another app, or there's another website, I should say, out there for those individuals that are getting the vaccine. You're going to be directed to check on the website. There's a program called VSafe. That's where we want people to go on and daily update the information as to whether or not they're experiencing a side effect. So this is self-reporting of individuals about any potential side effects. So that's another one. I want to jump back quick to another vaccine question that we get quite a bit. The question is, what about the second dose? How do you know there's going to be enough vaccine available for the second dose? And I think that's when we're going to start to get really busy, because this 1B is probably going to be starting about the same time as we're going to be vaccinating a lot of the 1A for their second dose. And when a dose is given to a recipient in the state of Wisconsin, their second dose is automatically reserved for them. Those are put to the side, they're put in a bank, those are accounted for. So if you get your first dose, you will be, a second dose will be reserved for you at that time. So there shouldn't be a concern that, well, if I get one dose, how do I know that I'm actually going to get a second dose? That dose is being reserved for you.
All right. Well, Heidi, again, I know this is going to be a very busy time, and we'll just keep chatting every week here about how the progression with the virus.
Yeah, thanks so much, Brian. And I just want to take a minute to thank the community members that sometimes take the hard road and step up and do the right thing. I was made aware of a situation that occurred yesterday. And we had some community members, individuals in charge of certain organizations within our community that stepped up and worked to assure the safety of our community. So I don't want to say a lot of details about it. You probably know who you are if you're listening. I just want to say thank you. Sometimes it's hard to step up and do the right thing, but I think if you may find that once you do that, others will start doing it along with you. So thanks for being leaders.
All right. Heidi Stewart, Pepin County Health Officer. You're listening to WRDN.